Hello, everybody, and welcome to this evening's webinar. I'm Libby Sheridan, and I'm one of your hosts for this evening. But thank you all so much for coming along to this evening's webinar. This is the first of two webinars in a series. So if you haven't already registered, we have another one coming up on the 12th of November on dietary choices for chronic enteropathy as well, again with Aarti, our brilliant speaker this evening. Without further ado, I'm going to introduce our speaker tonight, who is Aarti Kathrani, and I'm sure you know Aarti very, very well. Aarti is one of our foremost GI speakers, I would say not just in the UK, but all over the world, and we're really, really pleased to have her here this evening. So without further ado, I'm going to introduce Aarti. So Aarti graduated from the Royal Veterinary College, where she's currently working as well. So it's nice to be back at your alma mater, Aarti, as well, I'm sure. So Aarti graduated from the RVC in 2006, completing a rotating internship in small animal medicine and surgery at the QMH, followed by a PhD in canine inflammatory bowel disease in 2011. Aarti then went on to a 3-year residency at Cornell University, becoming a diplomat of the American College of Veterinary Internal Medicine in 2014, and then a 2-year clinical nutrition residency at UC Davis, achieving diplomat status there in 2016. Aarti is now Associate Professor of Gastroenterology, Internal Medicine and Nutrition at the RVC. So really no one better to help guide us through this subject of dietary fat sensitivity disorders in the dog tonight. So without further ado, we'll get cracking. Hopefully we can launch the presentation and then we'll see you in a little while. Thanks, everyone.
Thank you for joining me for this webinar on dietary fat-sensitive disorders in dogs. So the agenda for this webinar, we're going to look at different diseases where low-fat diets may be indicated in dogs. So firstly, we're going to start with intestinal lymphangiectasia. Then we'll look at other gastrointestinal disorders where low-fat diets may be indicated or helpful. So, for example, in hiatal hernias or gastroesophageal reflux disease, diseases or disease conditions that can cause delayed gastric emptying, and osmotic or secretory diarrhea. We're then going to look at hyperlipidemia, and I'll give a bit of a background on lipid metabolism, differential diagnoses we need to consider when we diagnose hyperlipidemia in a dog, how we investigate that to come up with the underlying cause, and then the treatment, particularly nutritional therapy for primary hyperlipidemia and also for pancreatitis. And then we'll just end briefly looking at miscellaneous conditions, particularly chylothorax. So to start with, we'll look at intestinal lymphangiectasia. So intestinal lymphangiectasia can be primary, where the underlying cause is unknown, or it can be secondary to many disease processes such as chronic inflammatory enteropathy or intestinal lymphoma. And the main diet strategy is low fat. That's because fat in the diet can stimulate the loss of lymph into the gastrointestinal lumen through chylomicron formation. And therefore, reducing fat in the diet can reduce this absorption of fat into the lymph. It can decrease lymph flow, decrease pressure in the lymphatics, and therefore their subsequent rupture and loss of lymph through the gastrointestinal lumen. There is some theoretical benefits of medium-chain triglycerides, as they may bypass lacteal absorption, but there needs to be more evidence really to highlight the benefits and to quantify the benefits of medium-chain triglycerides in canine intestinal lymphangiectasia. Also, if we use medium-chain triglycerides as a supplement to add to food, it may reduce intake because of the reduced palatability. However, good quality commercial diets will have formulated the recipe, so this factor, reduced palatability, isn't so much of an issue. And then other dietary strategies which may be beneficial depend on the underlying cause of intestinal lymphangiectasia, but can utilize either novel protein or hydrolyzed strategies, especially if chronic inflammatory enteropathy is the underlying cause. So typically the dietary options we have available to us when we have a case of intestinal lymphangiectasia in a dog, the first consideration is using a commercial therapeutic diet that is low in fat. That is something that is certainly used and can be beneficial. If you want an ultra low fat diet or you're aiming for a fat content lower than what's available commercially, we could consider a home prepared diet formulated by a board certified veterinary nutritionist to make sure that it's complete and balanced for long-term feeding. And some ingredients that we could consider lean fish such as tilapia, and that would also be novel for the patient. Other options would be 2% fat cottage cheese or chicken breast, depending on that patient's tolerance and acceptability of those ingredients. And then typically we're utilizing that with white rice as the carbohydrate source. In terms of how much to decrease the dietary fat by, this is just an arbitrary value. We say to reduce it by at least 50% of what the pet is currently consuming, and that may be enough to try and get some benefit from that. So that is something that we can try as a first off. And so in order to do that, we need to calculate the amount of fat that dog is currently consuming. And so in the next slide, I'm going to talk about how we compare nutrients between different foods to get the most accurate comparison. So if we wanted to compare the fat content or really any nutrient between diets, there are three main ways to do this. The first is on an as-fed basis. And that's the amount that's present on the pet food label. That's telling you if the animal eats 100 grams of that particular food, that's the percentage fat it will consume. Now, when you're comparing a dry versus a wet diet, because a dry diet is more calorically dense because it has less moisture, so moisture doesn't provide any calories. And so what that means is typically dry food on a gram basis has more calories. So the animal typically would have to eat less of the dry food to meet their caloric requirement when you compare that to a wet food. So wet foods have higher moisture content, so their calories, if you like, are more diluted per volume on a volume basis. So they would have to eat more grams of the wet food to get the comparative amount of calories. They'd have to eat more grams compared to the dry food to meet the same number of calories. And so because the animal would be eating more grams of the wet food compared to the dry food, the as-fed amount is listed on a 100-gram basis, so it's not comparable because an animal would eat more of the wet food to meet that caloric goal, so they're eating more volume. So if you compare the fat percentage, which is what is available on the pet food label, that's telling you the grams of fat per 100 grams, so that's giving you a percentage. If you compare the percentage of fat on a dry food, which is grams per 100 grams of food, versus the percentage on a wet food, which is grams per 100 grams of food, it's not accurate because the animal's going to eat more of that wet food, so it's going to actually consume more fat. So comparing it on a 100-gram basis, on a percentage basis, is not accurate because it doesn't account for differences in that moisture and caloric density. So one way around that is to compare nutrients on a dry matter basis. That's where you take the moisture out of the food and you're comparing it on what's left on the dry matter. That does make the calories more comparable, but it still doesn't account for any differences in caloric density that's left over. So the most accurate way to compare nutrients between diets is using the metabolizable energy method. And what that's doing is it's saying how many grams of that nutrient, so how many grams of fat per 100 kcals. So it's comparing it on a calorie amount. And because animals eat to meet their calorie requirement, if you compare the grams of nutrients on a calorie basis with different foods, that makes it more accurate, because they're going to eat the same amount of calories of the different foods versus they're not going to eat the same grams of the food, because the caloric density or the moisture is going to be different. So by comparing grams or percentage on an energy basis, on a metabolizable energy basis, it just makes it more accurate and more comparable between the nutrient contents between different foods. And so that's the method that we prefer when we're comparing nutrients between different diets. So how you do this, how you calculate fat on a metabolizable energy basis, the information you need is actually already present on the pet food label. Legally, it has to be present on the pet food label. So you can look at the pet food label, or you can find this information online. So they have to report the percentage crude protein, and you want this information on an as-fed basis, which is what is present on the pet food label. So you want percentage crude protein, percentage fat, percentage fiber. Percentage moisture has to be listed if it's more than 14%. So if it's a dry food, they either won't have it or they may have it. If they don't have it because it's less than 14%, you can either assume an arbitrary value of 10%, or you can call up the pet food manufacturer to get a more accurate number. And so the pet food manufacturer's details, again, legally have to be present on the pet food label. And then you also need the percentage ash, which could be listed as percentage inorganic matter or minerals. So this is an example of a pet food label where they've listed the typical analysis or the analytical constituents. And so we can get this information from this label. So if you remember, we need protein, which is listed on an as-fed basis on the pet food label as 6%. Fat is listed as 3%. Inorganic matter, which is the ash, is listed as 1.5%. Crude fiber as 1%, and moisture is listed as 72%, and because it's more than 14%, it has to be present on the label. So there are a couple of ways to get these calculators online. One is through the Balance It website. So if you type in www.balanceit.com on an internet search engine, you'll come onto the Balance It website, and if you go to the menu, you will see guaranteed analysis calculator. And so if you click that, you'll come onto this page. You can also use VIN, Veterinary Information Network. If you are a member, you can also find these calculators which help you calculate the caloric distribution or the percentage of protein, fat, and carbohydrate on a metabolizable energy basis from the as-fed values. So once you come across this page, what you need to do is you need to enter the different values from the pet food label into those respective boxes on the left-hand side. So just as a reminder, the example we used on that pet food label, we had protein 6%, fat content 3%, inorganic matter 1.5%, crude fiber 1%, and moisture 72%. We then enter those values on the left-hand side and we click calculate. And what you can see on the right-hand side is a caloric distribution estimate. So what this is telling us is that 20.14% of the calories in this food is coming from protein, 24.46% is coming from fat, and then the rest is coming from carbohydrate. So let's say, for example, you had a dog with protein-losing enteropathy due to intestinal lymphangiectasia, and you wanted to feed a low-fat diet. And if this is the diet this dog was being fed, you can enter the values onto this calculator, and you will see that this diet has 24.6% fat on an ME basis. So if we wanted to reduce that amount by 50%, you're looking at a level of about 12 to 13% fat on an ME basis. What's available commercially, so the therapeutic gastrointestinal low-fat diets, they're around 16, 17, 18%. So we could either reduce it to 16, 17% and see what effect that has, or if you wanted to go lower than that, really we're looking at home cooking with an ultra low-fat diet to try and get below 16%. So this is a nice way to see what your patient with intestinal lymphangiectasia, what's the current fat level it is consuming, and it kind of allows you to see how much scope you have with reducing the fat and what options you have available. If this dog was eating a 50% metabolizable energy fat content diet, then we have more options available to us because half of that would be 25%, and even this diet might be an option for that dog. So it's really knowing what the dog is currently consuming and how much margin we have in terms of what options we have to feed that dog to hit that 50%. Depending on how much it's eating, you might even be able to get lower than 50%. Sometimes where we might have to compromise that 50% because the owner doesn't want to home cook and we're going at 30 or 25% reduction. But it's nice to have an idea of how much reduction in fat the kind of therapeutic diets offer, so then you kind of know what kind of impact might that have on clinical signs and what options we have available. So I'm just going to present a couple of studies, just really highlighting how reducing the dietary fat can really help these patients with protein-losing enteropathy and intestinal lymphangiectasia. So this first study was a prospective evaluation of a change in dietary therapy in dogs with steroid-resistant protein-losing enteropathy. So this study had 15 dogs eligible for enrollment, and 12 were enrolled and 10 remained in the study at 30 days and 9 completed the 3-month study period. So they changed the diet in these dogs, and for 8 of them, they achieved complete remission, 1 partial, and 1 dog had no response. 7 of the 8 dogs that achieved complete remission had remained in remission up to 4 years following the study. And in the dogs with complete remission, the median clinical disease activity was 11.5 and 4, and the median serum albumin concentration was 15 and 26 at 0, 14 and 28 days respectively. So this is the table from the study, and it's just showing you the diets that these cases were switched to. So you can see in the 4th column from the left, that's the study diet. You can see quite a few of them were switched to a commercial therapeutic low-fat diet, and then some of them were on home-cooked low-fat diets as well. And then in the column before that, you can see the diet that they were consuming at the time of enrollment. So they switched the diet from that left-hand column to the right-hand column, and for the majority of these dogs, they went into complete remission. So this is just really highlighting how switching the diet if they're not responding, so if this is a refractory protein-losing enteropathy, switching the diet and typically to a lower fat diet can help these dogs go into remission. So that is certainly providing evidence that low-fat diets are beneficial in this disease, or may be beneficial for a subset of dogs with protein-losing enteropathy. And so certainly it's a strategy to consider, especially if that patient is not responding to immunosuppressive medications. So just to reiterate, as we said in the previous slide, this study concluded that dogs with protein-losing enteropathy with previous lack of response to a combination of dietary therapies, glucocorticoids, and immunosuppressive medications can achieve remission following a dietary change, and that improvement is likely to be seen within 14 to 30 days. And so really a change in dietary approach, particularly transitioning to a lower fat diet, may be an alternative to further immunosuppression or anti-inflammatory strategies in some dogs with difficult to treat protein-losing enteropathy. And then lastly, this study was a study on prospective evaluation of low-fat diet monotherapy in dogs with presumptive protein-losing enteropathy. So in this study, they showed that 11 of 14 dogs were in clinical remission at the study end date. So that was 6 months after enrollment. 6 on low-fat monotherapy diet and 5 on low-fat with immunosuppressive medication, so prednisolone. And the low-fat diet, the monotherapy diet, achieved a significant reduction in the clinical disease activity index and a significant increase in serum albumin within 2 weeks of beginning dietary monotherapy. They showed 4 out of 11 dogs in remission also had ultrasonographic evidence of resolution of linear striations, and they concluded that low-fat diet appeared to be an effective monotherapy in some dogs with presumptive protein-losing enteropathy and ultrasonographic evidence of lymphangiectasia. And so if you have a case of protein-losing enteropathy on ultrasound, you see these linear striations or speckling, kind of evidence of lymphangiectasia. And so in a couple of scenarios, you might have one where the owner doesn't want to pursue intestinal biopsy, or they don't want to do immunosuppressive medications, then you could try a low-fat diet and see whether the clinical signs and the albumin improve within 2 weeks of beginning that therapy, because there is some suggestion that for a subset of dogs, low-fat diets alone may be enough to improve their clinical signs and their serum albumin. Or it could be for those cases that have protein-losing enteropathy where their albumin is not significantly decreased. So if it's above 20 grams per liter, then you might consider trying a low-fat diet on its own just to see what effect that has on the clinical signs and on the serum biochemical parameters, so the albumin, globulin, and cholesterol. So this study is nice. It's providing evidence that low-fat diets on their own or with prednisolone can help with clinical remission, and really deciding whether to try low-fat diet monotherapy, it really depends on that individual case, how severe their clinical signs and their biochemical abnormalities are, and really what the owner's restrictions are as well, and what their preferences are. So it's really that decision is made on an individual case-by-case basis. But certainly this study is nice because it provides evidence that for some dogs, monotherapy with a low-fat diet may be enough to help them. So we're now going to move on to where low-fat diets may be indicated in other GI disorders in dogs. So one area is in those dogs with hiatal hernias. So for example, in the brachycephalics with hiatal hernias, or in a dog with gastroesophageal reflux disease. So feeding a low-fat diet to these patients may help because fat is a moderate or high fat diet is emptied slower from the stomach. So if you can lower the dietary fat, that might help to increase gastric transit and then less chance of that reflux happening into the esophagus. So that's really the theory there with feeding a low fat diet, is really just to help with gastric emptying. It's important with these conditions such as hiatal hernia and gastroesophageal reflux disease to feed smaller amounts of food more frequently during the day, because smaller meals also empty faster from the stomach. So it's not just enough to reduce the fat, we also want to reduce meal size as well. And then also for those cases with delayed gastric emptying, so gastroparesis, there's all sorts of different conditions that can cause gastroparesis. For example, a gastric ulcer could be one. And so, sometimes we have ileus cases as well. And so in those cases that are particularly nauseous or vomiting, They might have some pyloric disease as well, which could lead to delayed gastric emptying. And so if we have these clinical signs of nausea and vomiting, then we may also want to feed a low-fat diet, smaller meals to again help with gastric emptying as well. So that is something to consider. That's also a disease to consider, feeding low-fat diets too. And then finally, we might have some cases with osmotic or secretory diarrhea, where the undigested fat that's passing into the colon is either acting as osmoles in the colon, and that's drawing water, resulting in diarrhea, or that undigested fatty acid is irritating the colonic lining and causing secretory diarrhea. And there's also some evidence from animal mouse models where undigested fat in the colon can also contribute to dysbiosis. So there's no way to definitively prove that patient has osmotic or secretory diarrhea. If you have a patient where the diarrhea is getting worse with feeding, or you suspect the secretory diarrhea, then in these cases, potentially feeding a lower fat diet may help to improve the amount of undigested fatty acids that are moving into the colon and causing osmotic or secretory diarrhea. So you can try feeding it as a trial to see if it improves the diarrhea. So that's another GI disorder where we may consider feeding a lower fat diet. So for the rest of the webinar, I'm now going to talk about hyperlipidemia. So we're going to look a little bit at the background of hyperlipidemia, the differential diagnoses, how we investigate the underlying cause, and then we'll look at dietary management of primary hyperlipidemia and also at pancreatitis. So we're going to start with lipid metabolism. So lipids are water-insoluble organic compounds, and they are essential for many physiological functions in the body. For example, they're really important constituents of the cell membranes. They act as an important energy store. They can function as certain enzyme cofactors. They're important constituents of hormones and act as important intracellular messengers. So the three important lipids that are important clinically are fatty acids, sterols, so mainly cholesterols, and acyl glycerols, which is mainly triglycerides. So this is just an example of a molecular depiction of fatty acids. And if you remember, there's two types of fatty acids. So the saturated fatty acids have those single bonds, and then the unsaturated fatty acid, they have a double bond. And then the molecular schematic of cholesterol is shown on this slide. And cholesterol is the main sterol in animal tissues. And dietary intake is a big source, and it's involved in bile acid metabolism, an important constituent of steroid hormone, and it's also involved in vitamin D synthesis. And then finally, we have the triglycerides, and these are the most common and efficient form of stored energy in mammals, and they can obtain this either via the diet or they can produce it endogenously. And so with the triglycerides, they have that glycerol backbone, and then they have the three fatty acids, which is depicted on this slide using that schematic. So with regards to lipid metabolism, lipids are water insoluble, so they need to be transported in plasma as macromolecular complexes known as lipoproteins. And in dogs, lipoproteins consist of chylomicrons, very low density lipoproteins, which is abbreviated as VLDL, low density lipoproteins, which is abbreviated LDL, and then high density lipoproteins, which is abbreviated HDL. And in dogs, they have HDL1, which is unique to dogs, and also HDL2 and HDL3. In humans, they also have another lipoprotein known as intermediate density lipoprotein, which is abbreviated IDL, but that hasn't been verified in dogs. And then when we look at lipid metabolism, it can be divided into two basic pathways. So we have the exogenous pathway, which is where the animal is consuming dietary lipids. And then we have the endogenous pathway where those lipids are being produced endogenously. So the exogenous pathway consists of the dietary lipids. So they are consumed in the alimentary tract, they're digested, and then they're reassembled into chylomicrons. These then travel into the lymph and into various tissues, and they go into tissues as triglycerides, and they're stored in tissues as triglycerides. And then the chylomicron remnant, which is cholesterol rich, is used to form the very low density lipoprotein and bile acid formation, or they can be stored as cholesterol esters in the liver. And so with the endogenous pathway, triglycerides are endogenously synthesized, and also cholesterols that are endogenously synthesized. They combine with phospholipids to form very low density lipoproteins, which are used to deliver triglycerides to tissues. Once they've done that, the VLDL remnants are converted to low-density lipoproteins, and they deliver cholesterol to tissues, which are used in the synthesis of steroid hormones and cell membranes. The high-density lipoproteins take part in the reverse cholesterol transport pathway, which is where cholesterol is transferred from peripheral tissues to the liver. So you can see a schematic here highlighting the two lipid metabolism pathways. So on the left, we have the exogenous pathway, and then on the right, we have the endogenous pathway. And so on the left, the exogenous lipid metabolism pathway, it begins in the top left-hand corner with dietary lipids that are ingested. They are then digested and absorbed in the small intestines and form part of the chylomicron complex, which goes into the capillaries and is metabolized by lipoprotein lipase into free fatty acids that enter the various tissues. And then the chylomicron remnant goes to the liver. And then the endogenous pathway on the right-hand side, that starts with VLDL from the liver. That delivers free fatty acids to different tissues. The remnant is the IDL, which that's in humans, and we don't know if that occurs in dogs. But then you have the low-density lipoproteins, which release triglycerides and fatty acids to the peripheral tissue, or it can go to the liver. And then we have the high-density lipoproteins that are involved in the reverse cholesterol transport pathway. So if you imagine the low-density lipoproteins are delivering cholesterol and lipids to peripheral tissues, whereas the HDL is removing those cholesterol and lipids to the liver. So it's doing that reverse pathway where it's taking them from the peripheral tissues and delivering them to the liver for processing. So that was just a general overview of lipid metabolism. We're now going to look at disorders of lipid metabolism. And so there are many terms you might come across. So I'm just going to cover them here. So hyperlipidemia is when we have increased lipids in the blood. Hypertriglyceridemia is when we're specifically talking about triglycerides being increased in the serum or blood. Hypercholesterolemia is when cholesterol is increased. Lipemia, when the serum is turbid or milky, it typically means that there is hypertriglyceridemia. It's the triglycerides that are causing the serum to be turbid and milky. It's not the cholesterol, it's not hypercholesterolemia that contributes to that. Typically, we say if it's turbid, the serum, then typically the triglycerides would be in the range of 2.26 to 3.39 millimoles per liter. And if it's milky, it would be above 11.3 millimoles per liter. So sometimes when you've collected a blood sample or you've spun it and you've collected the serum, you might see a layer of lipid. And so you can do a test known as the chylomicron test to determine whether that lipid is made of chylomicrons, i.e. is it due to post-feeding, is it postprandial? How we do that is we can refrigerate. It's a refrigeration test and it's performed on the lipemic serum. We leave it in the fridge undisturbed for 10 to 12 hours. And if you see a cream layer, that means it's chylomicrons. And because chylomicrons come from exogenous dietary fat, that is most likely due to postprandial, or the sample or the pet has not been fasted for long enough. If there's no cream layer, then that is being contributed by other lipoproteins, usually VLDLs. So this is just an example of what you may see after the refrigeration test. On the right-hand side, you can see this layer of lipid, and so it's separating out. So that is consistent with chylomicrons. On the left, after refrigeration, there is no layer, and so that is consistent with other lipoproteins, usually VLDLs. So causes of hyperlipemia, so it can either be postprandial, and that typically is physiological and transient. And if you suspect that's the cause, we should be fasting the pet for at least 12 hours and then repeating the sample, and that should resolve. Or you can do the refrigeration test to confirm it's chylomicrons. If after fasting we still have persistent hyperlipidemia, that is always considered abnormal, and it can either be primary or it can be secondary to another underlying cause. So we're now briefly going to talk about primary hyperlipidemia, and this generally appears to be relatively uncommon in dogs, and when it is present, it's usually, however not always, associated with specific canine breeds. So the most common breed that comes to mind would be the miniature Schnauzer. So this is primary hyperlipidemia in miniature Schnauzers. And they have an abnormal accumulation of VLDL or VLDL plus chylomicrons. And in these cases, hypercholesterolemia may be present, but it's not always a consistent finding. And so the primary hyperlipidemia in miniature Schnauzers, unfortunately, the exact etiology is unknown, but what we know is that we shouldn't ignore it. There can be consequences of that hyperlipidemia or hypertriglyceridemia. As studies have suggested, it could be associated with pancreatitis or hepatobiliary disease, ocular disease, and possibly other conditions such as neurological conditions. There's also studies that have shown it can lead to proteinuria as well. So recognizing and treating it is really important. There are other breeds that have been reported to have primary hyperlipidemia. So primary hypercholesterolemia without hypertriglyceridemia has been documented in 15 Briards in the UK. And there was also a similar condition described in a family of rough collies from the UK and also in Shetland sheepdogs. And primary hypercholesterolemia has been anecdotally reported in Doberman Pinschers and Rottweilers. And primary hyperlipidemia with hypercholesterolemia and hypertriglyceridemia has been reported in 2 related beagles. And then finally, primary hypertriglyceridemia has been reported in 2 Brittany Spaniels and 1 mixed breed 28-day-old puppy. So secondary hyperlipidemia is probably a more common cause, and it can be secondary to several diseases. For example, endocrine diseases such as hypothyroidism, where increased triglycerides has been seen in 88% of cases and increased cholesterol in 78%. In diabetes mellitus, we can also see increased triglycerides, and we may also see increased cholesterol. And also in hyperadrenocorticism, we can see increased triglycerides and increased cholesterol. Another cause of secondary hyperlipidemia is pancreatitis, where the presence of hypertriglyceridemia with or without hypercholesterolemia has been associated with naturally occurring pancreatitis. However, it's uncertain if this is a cause or effect for some cases. Obesity has also been associated with hypertriglyceridemia with or without hypercholesterolemia, and interestingly, weight loss in these obese dogs has led to significant decreases in both triglycerides and cholesterol. Protein-losing nephropathy is another cause of hypercholesterolemia, although the exact mechanism is unknown. Cholestasis has also been shown to increase cholesterol and may also cause a mild hypertriglyceridemia in some cases. Finally, other causes reported for secondary hyperlipidemia include high-fat diets, lymphosarcoma, Leishmania infantum infection, congestive heart failure due to dilated cardiomyopathy, parvovirus, and administration of certain drugs, for example, glucocorticoids. So the clinical signs and complications of hyperlipidemia, occasionally these may develop in dogs with hyperlipidemia, and this can include pancreatitis. Its association is obvious, but cause and effect sometimes can be difficult to establish. It may also lead to hepatobiliary disease such as vacuolar hepatopathy and gallbladder mucocele. And then atherosclerosis, dogs are relatively resistant, but it's mainly associated with secondary hypercholesterolemia due to endocrinopathies, and there have been cases reported in the literature. So treatment of hyperlipidemia, the first thing is to determine whether the patient has a primary or secondary lipid disorder. If there is a secondary cause, then treatment of that, the treatment of that secondary hyperlipidemia relies on the successful treatment of that primary disorder, after which the hyperlipidemia usually resolves. After you've ruled out secondary causes of hyperlipidemia, that's when we make a presumptive diagnosis of a primary lipid disorder. Primary hypercholesterolemia is usually associated with less severe complications compared to hypertriglyceridemia. So treatment of primary hyperlipidemia, so dietary management is really one of the cornerstones here of treatment. And so we would institute a low-fat diet for at least 4 to 8 weeks. And options here would be commercial therapeutic low-fat diet or utilizing a complete and balanced home-cooked diet formulated by a board-certified veterinary nutritionist. If that didn't help, then typically we escalate to medical management to decrease triglycerides. That could either be omega-3 fatty acids, so DHA and EPA, and the formula we use is body weight in kilograms to the power of 0.75 times 120, and that will give you the mgs of DHA and EPA to use. Fibrate therapy, and there's different fibrates available to use. Niacin, although this may have side effects that can include erythema and pruritus. For those cases that are diagnosed with pancreatitis, dietary therapy would include a low-fat gastrointestinal diet, which are frequently recommended in the initial management of pancreatitis in dogs. Just need to be aware that if there's a comorbid disease, that may alter what nutritional recommendations we make. And so when the disease occurs concurrently with another dietary responsive disease, typically we say the dietary strategy for the most life-threatening illness or the illness with the greatest impact on that patient's quality of life is recommended to be prioritized if you can't incorporate all the nutritional strategies for both or multiple diseases. Many dogs with pancreatitis can be transitioned back to their pre-diagnosis diet or another commercial maintenance diet, provided that significant comorbid disease is absent. And use of a low-fat diet in the long term may be prioritized in dogs with recurrent episodes of pancreatitis. For some cases of canine pancreatitis, we may say to reduce dietary fat by 50%. Again, this is an arbitrary percentage reduction, but it may help determine what options you have for management. So this goes back to what we talked about at the start with intestinal lymphangiectasia. If you can calculate how much dietary fat that dog was receiving, then depending on the level it was receiving, you'd be a 50% reduction of that would allow you to determine how many options you would have for a 50% reduction. So you can also utilize that method in terms of determining what the level of dietary fat to feed the individual canine patient with pancreatitis. And then finally, we're just going to look at a miscellaneous cause, which is chylothorax. So I'm just going to look at dietary therapy here. There's obviously other medications and surgical options for chylothorax, but we're just going to focus on dietary therapy. And so chylothorax is the accumulation of chyle within the pleural space, and there are many causes. I've just listed a few on this slide. So idiopathic, where we don't find an underlying cause, but there can be various cardiac disorders, infectious, lung lobe torsion, neoplasia, trauma, thromboembolism, and there's others as well. For those cases that are diagnosed as idiopathic, we can say to feed a low-fat diet. For the other causes, if there's an underlying disease, usually we would say to target treatment and the underlying disease. But for those cases where you don't have an underlying disease, then you could try feeding a low-fat diet. And the theory there is that it may decrease the lipid content of the chyle, which then may allow it to be reabsorbed more easily by the pleura. And so this would be one part of the management. Obviously, there would be other management options for chylothorax depending on the cause. Even if it's idiopathic, there might be other medications or surgical options, but this is just one part of the therapy in terms of dietary therapy that you might want to consider. And finally, I would like to thank you so much for listening to this webinar, and I really look forward to answering any questions you might have.
Thanks very much to Aarti there for that brilliant presentation. Aarti is still with us and very happy to answer any questions that you might have if you pop them into the Q&A box, and we will do it afterwards. So I just wanted to take you now just through a very short presentation about some new products that we have within our gastrointestinal range, and then we'll go to the Q&A. So this is our new portfolio, our new range of our EN gastrointestinal diet. You can see there the traditional diets there in the canned version, and the dry for the dog, and then the canned, dry and pouches for the cat, and some exciting new additions into that range, which I'll talk you through now. So the first of these is our little mini can. So it's just a little 195 gram can for dogs. This is the same formula that's in the 400 gram can. It's just in a little mini formula. And that can be quite nice when you're feeding little dogs. But also kind of, you can use it as a topper on your dry food, but also quite good, I think, at reducing wastage if you're only feeding kind of small amounts out of a bigger can. So that's now available through your wholesalers. Next, we have a new formula for the range, and you can see here the little papillon on the front of the pack. And this is our EN gastrointestinal small and mini dry product, which has just been brought out. So this is a product that's got all the features that you can expect with the normal EN. So it's formulated with really easy to digest ingredients that helps to kind of ease the workload of the gut, particularly when it's under pressure. And it also promotes good stool quality with a blend of fibers, soluble and insoluble in there. And it's also got prebiotic inulin in there. And we know that that can help kind of with the microbiome balance and also with maintaining digestive health. And then it has a limited fat content like our standard EN, and it is higher in medium chain triglycerides, which allow us to bring down the long chain fatty acid content as well. So quite a nice addition to the EN range for those little small and mini dogs. But also some other features it has is that it is a smaller kibble to make it easier for them to eat. It also has been adapted, the recipe, to help to support that faster metabolism of these little small and mini dogs. And then you'll also see on there our STOX claim, and you will more normally see that on our feline products, but it's here in this canine small and mini range, and that shows that the formula has been made to minimise formation of struvite and calcium oxalate in the urinary environment. So we heard a little bit on Aarti's video there about how a limited fat diet can help to minimise the risk of that fat malassimilation that might be taking place. And we know that malabsorbed fats can have several consequences. Aarti spoke there about potentially causing a dysbiosis, altering the microbiome composition. It can result in pro-inflammatory compounds, and also kind of by osmotic means sort of draw water into the colon, resulting in those loose stools as well. We heard also about some specific conditions where they may benefit from even lower dietary fat levels. So in our standard EN product, the dry, there is limited fat in there, but within the low fat EN range that we're now launching, it's an even lower level of dietary fat. So those conditions such as pancreatitis, hyperlipidemia that we've heard about, and PLE as well can all benefit. So this is the new product that we're launching. So it has all the benefits, that we know and love with our normal EN gastrointestinal range, but also has that lower level of fat in there as well. So this is now coming into the veterinary wholesalers in the UK, and those in other markets, it's worth contacting your Purina representative to see if the product is in stock. I know it's being launched across quite a few of the markets at the minute. But if you would like more information, please do get in touch. You can speak to your Purina representative, visit our vet centre, which the address is here, vetcentre.purina.co.uk, and you'll find all the information on there about the product. So thank you very much for your attention, and we'll look forward now to our Q&A.